Our bodies have very primitive nervous systems. Even the email that you got or the text, chronic low-level stress like job stress or, internet or being connected all the time, we're not built for that. That's constant cortisol. And it's exhausting. It's the constant stimulation of a primitive nervous system that men don't know is that primitive, right? They think they can control it or whatever.
And so that lowers their testosterone?
Absolutely. Almost by 50%.
And then that lowers sperm production. This is it. This is the most anticipated episode of the Baby Makers.
What?
Yeah. Because Dr. Turek, it's about the men, and they've been so underrepresented in the field of fertility. So who better than you? In my opinion, my experience is you are the world leading male urologist. And that's why it's my honor to be able to interview you and to pick your brain and to spend this hour with you, finding out everything that I can for my listeners and their husbands,
all the partners,
their male partners, to know what they can do, because we got to start, we got to dial it up.
It's a little
too late,
unbalanced, isn't it, right now?
Yeah. Yes, but now that the men have their 300 little blue pills, I love this joke. Now the women are getting what they need, but in the fertility realm, now that the women have been tested, prodded, procedured, protocoled, now we can bring the men in and, as you say, use fertility as a biomarker for health.
Yeah. Also, right? I would say, what other disease, infertility is a disease. Thank you for that, by the way. What other disease do you treat the opposite sex for your problem?
I love that you said that in your podcast, because there isn't anything. It makes no sense.
STDs.
Okay.
Right? Sexually transmitted diseases, you'll do it.
Well,
but
you'll
that's
treat.
it. In medicine, that's it.
Right. You'll treat your partner to prevent you from getting something or something.
Well, whatever. You treat both. But
right. But here, the
it's
women
crazy.
are.
And what they have to go through, women have to go through, is crazy if a guy has a low sperm count. And a lot of those are treatable.
Yeah.
So.
Well, so I'm going to back up our conversation to 2017 when I saw you on stage speaking in Vancouver at the Integrative Fertility Symposium, and you were talking about advanced paternal age. And it was very clear that was not your entry into this. You have over 200 publications. You were the editor in that Netter Male Reproductive.
Right, so the green book called the Bible of Medicine. Yeah.
Yep, for male reproductive anatomy. Yeah. And your blog, the Turek blog, and speaking around the world about men's health. Yeah. So that day, I was sitting in the audience, and advanced paternal age applied to my case, where my kid's father was 44 and 47 when we conceived, Kira and Jack. And you said that it's not just the age of the egg that matters, it's the age of the sperm. So just right there, that soft entry into we've got to talk about men and get them in earlier. And I want to come back to that. But that was when I was like, this man has so much to say. It is prolific, everything. And we're going to talk about so much of it, as much as we can.
I'll just make one comment on that. I won't go into scientific depth, but the problem of paternal age and fertility, as well as offspring health, is brand new to the species. Because if you think about it, older paternal age is variably defined between 40 and 50, men of 40 and 50. But we only lived to about 40 years old in 1910. In 1960s, we were around 70. So it's only been about 2 generations or 2.5 that we've lived long enough as a species to be able to have this problem.
Right.
So it's brand new, never seen before.
Yep. That's what
scared me a little bit about it. So
right. But then for you to be brave enough and your presentation style and to show us, hey, look, at 40, these are the things that start happening with the sperm and the offspring. And Kira has girl ADHD, so a developmental thing, and that was a 44-year-old sperm. And then Jack had a heart valve defect, 47-year-old sperm. So I was sitting there going, not only is he brilliant that he's talking about this when nobody else has, and that it's pretty scary, and what's the...
I don't like to scare people, but
yeah,
hopefully it was a balanced lecture.
It was humorous, it was intelligent, it was a lot of information, and I really appreciated it. So then we met again at Yosan when you went into faculty, and I was working on the doctorate. And that's an interesting story. Like, why would a guy who was raised in the Ivy League, complete loyalist, academic, Western medicine professor at UCSF, quit and go Eastern? Yes,
just
why?
In like one fell swoop. It's simple. I think that Western medicine is great, but it's a little too reactive to me. And I think Eastern styles and alternative medicine is much more holistic and proactive. And that's what we're missing in Western medicine. Mm-hmm. So I found it at Yosan and with providers like you, which is you take care of, in fertility example, you take care of the whole individual, the stress management, diet, lifestyle, all that stuff. And these men are kind of sorted out when they see me. But usually from Western, they're obese, their diet's not good or whatever. They're stressed, they're running too hard. They don't understand that it's the whole thing. And I love that. We don't do that.
You do that.
Yes, I do. Yes.
So you needed to be amongst a different league of people.
So I literally switched gears in mid-career.
Yeah. So we need to talk about some of these holistic problems that the men are having. Sure. And I think to say another thing you said was IVF with ICSI is the worst thing that could have happened to men. And it's true. And I make comments like...
finally, someone agrees with me.
Yeah, I totally agree. But I've also said, and then had people be really sadly affected when I said, we are evolving to become less fertile. As you're saying, we're evolving, we're getting older and all this, but we are less and less fertile all the time. So we have the Starbucks, we have the sugars, we have the inflammation, we have the counts are down, we have the increase in miscarriages. We have all of these different uterine factors and lower egg reserves. And so, as technology advances, as inflammation increases, we are in jeopardy as a species. And
so
it's hard to hear that.
Clarify that statement a little bit, because it sounds like I don't like IVF. IVF is great. I mean, for cancer survivors and men with untreatable conditions with low sperm, it's really a wonderful way to go. But it's very involved, especially for the other partner. And I do believe that it's being overused in Western countries a little bit, certainly North and South America, because men don't get the simple medical evaluation they should have before they do that technology. So I think the data in America from the Andrology Consortium was 23% of male partners who have infertility issues, who go to IVF, have seen a specialist and been evaluated before they go to IVF. So they have a sperm count, but that's not the story.
That's not an evaluation of the whole. And
if the sperm count's abnormal, they'll still go to IVF, and so there's a missed opportunity. And so men's health depends on that evaluation. Now we know this. It depends on it, because otherwise you'll never see them.
You'll never see them. They don't go and show up.
They're partnered. They're immortal. They're not in pain. Nothing threatens their lives.
Even if they are in pain, even if they are overweight, even if they're struggling with high blood pressure or whatever, they will stubbornly.
So there's a golden opportunity for young, healthy men to get some medical care they never would have achieved by just having the partner say, "Do this for me." Do it for they won't do it for themselves lots of times, but if you say, "I love you, I really want this, do this for me," that's the secret to men, to get into men. So, the hard facts, and I see this a lot, is the richest man in America lives 6 years less long than the poorest woman. So there's large inequity. The average Afro-American man in America, half of them live long enough to collect Social Security. Death by suicide is 4 times higher in men than women. These are 9 out of 10 cancer deaths, 9 out of 10. Men lead in 9 out of 10 cancer deaths, types of cancer. It's just ridiculous. And it's complicated. And there's a lot of cultural, socioeconomic stuff going on. But the fact is that when men are coupled, they live as long as women. When they're uncoupled, they don't.
Now, see, the women are prodding them along.
There's something going on.
They're loving them.
There's
They're
a lesson there.
Giving them an opportunity to express their feelings.
So that's why I said that statement about the worst thing to happen to men's health
is IVF
because
ICSI.
They have cancer of their testicle. It causes a low sperm count. They go to IVF, they have their child. They're not going to get found out until it becomes spread. Mm-hmm. Right. So, I mean, I see that around once or twice a year. Mm-hmm. And it's a shame. It's probably the reason why Germany with single payer system. This is where I first said it, because I was giving a talk in Germany with the German andrology team years ago, and they said, we find our testis cancers really early, and you guys seem to find them later than we do. And we're figuring why. We both have good health care. Well, they have a single payer system, and their fertility, the government pays for everything. So if you're going to choose between evaluating the male or the female first, the male is cheaper and faster. So, and it's a third of the problem. So you do that first. So they do that first. They find those cancers really early. And we do that. Maybe we don't do it. And then we don't find it until it's later. So it was a really clear. And I said, oh my God, this is clearly an issue.
Yeah. It's kind of an issue of that's medicine being practiced in other countries, and in America, fertility is a business, and the women,
it's become a business,
the women are driving it because they're more emotionally connected to their biological imperative, use their uterus.
Yeah, I mean, it gets a lot done when you do IVF early on, but I just want to bring up, the elephant in the room, which is men's health and all of this.
Exactly. So how can we, here at the kind of beginning of the episode, encourage men to get these physicals, or what would they want to look at, do you think? What's like the minimum thing that they should be checking, and at what age? Like question. Age 35? Or
that's a great question. And it's not clear, and there's nothing sort of standardized. But I did on my podcast Talk with Turek, I did an episode with Neil Shaw in 2024, and we talked about that. Like, why isn't there an Office of Men's Health? There's an Office of Women's Health. And that's been around for 30 years, done amazing things for cancer, breast cancer, et cetera. It's consolidated lots of nonprofits. It's having sort of a federal voice or, mentor behind everything. And the Office of Men's Health has never really made it. It's too partisan. I don't even know what's going on, but I've been behind it a couple times, the Men's Health Network in Washington, and it's failed. Congress is very partisan, and so it's hard to, when someone wants something, someone doesn't want it because they want it, right?
Get kind of stuck.
Yeah, so it's a hard time to do it. But he proposed the idea is the semen analysis the new pap smear? Okay. So I would want something that would be like an ovulatory cycle, because I always call myself the GUI gynecologist, right?
Guy.
So we need a marker.
Right.
We need a marker, and I don't know what it is, but...
Well, and you've taught me the variability of the semen analysis.
It's very high.
How it is on one day, it could be very different later in the afternoon on the same day, right? Or the next day.
Testosterone, semen, it's
stress level.
Terrible variation. You only can look at it as a gut feeling sort of on things. And you have to have a couple of them for an average.
That's why you take a couple of them.
Yeah. So it's not a diagnosis. It's only exclusively in very rare situations like zero. Would it be, you can actually make a diagnosis of something, but... And I would call it, and had been published to say it's a blunt instrument for looking at infertility. It's just not that good.
So what things could we maybe add to it to give us an indicator of his averages and some overall health?
So I'll tell you, I gave this talk at the Integrated Symposium too, but I look at the semen analysis as a poker hand. So you have a count, a motility, a volume, a shape, other things, and each in the poker hand, each card represents one of those features of the semen analysis, and then they have a look. So they can represent something individually. Low volume is always significant. It always can be explained, but they also have a look. Is it a flush or a pair or four of a kind? And so that
Meaning
look,
like how bad is it, sort of?
no, just the look of all of them together.
Okay.
The combination of a low volume, a normal count, and a low motility, 3 things come into my head. Right. So it's a gestalt. So I take advantage of the look. That's the way I look at it. It's a poker hand where they have, okay, I have these cards with these values, but then I have a look that says this. Is it a royal flush or not? And I've used that to make very good decisions about things because it is a nice way to take advantage of all the features of it. And I've even gone to the point where I've said to men, based on your history and physical, which is essential, and the semen analysis, you're done. You're fine. You're not, you have an infertility problem, but you're not the problem. There's no problem with you.
Right.
I call it cleared male factor. So I cleared these men, and of course the couples did that, and they went online and they said Turek couldn't figure out what was wrong with us, and I got kind of angry, and I said, that's not what I said. I said that he's fine. I don't comment on the female. I'm a male guy, and so I would give him a stamp of approval and little badge, certified fertile. And so that got me a little upset. So I decided to study it. So I had a USC resident follow these couples for a year after I cleared them. Didn't treat them. I didn't fix their varicoceles
because they were cleared.
Give them medication. Right. They were fine. I said, spend your money elsewhere. And they had things that could be fixed, but I just didn't believe that was the problem. So at the end of that year, 65% had conceived naturally. These were on average 35-year-old women with a year of half infertility. So they weren't waiting around. And most of them conceived within 6 months after seeing me. And almost all of them by 9 who had 65% natural at-home conceptions. And then about another 20% were IUI or IVF conceptions. So that's an 80% pregnancy rate without touching the guy after evaluating him fully, right? So to me, in this paper, I published, we can't beat that with any therapy we offer men. You can't beat a 65% at-home conception rate following a visit by anything, reversals or, that's really high. And I list the pregnancy rates associated with the things we do offer that are classical treatments. So I published it as a lifestyle study. I said, if patients are educated and they take prenatal supplements and they stop baths and they stop pot and they take good care of themselves and stay super healthy, like they're training for an Olympic sport, then, stress control, diet, everything, that's valuable. That's what it was, a lifestyle study. I didn't get mad at them. I just said, I didn't say, see, I was right. I just said, it works. Diet and lifestyle work.
My study proved that women can become more fertile over time if they are told what to do and they show up just like a little bit. Not become obsessive compulsive, but if they empower themselves with...
Make some changes.
Yeah.
And it probably on the realm of diet and lifestyle,
exactly.
Right? Like stress control.
Fertile foods and fertile thoughts, and just like believing in themselves again. To essentially be clear that there's nothing dangerously wrong, but that the issue is within themselves and how they're approaching the situation. So perhaps some of those men, their wives, knowing that you had cleared them, helped them to think.
It takes the burden away.
Yeah. Yeah.
Sure. I am completely, the anecdotal reports of couples failing IVF and getting pregnant at home the next month are crazy numerous in my practice, right?
Where they know, like, okay, we took it as far as we can go.
They're spent. It's like the stress is over. We're done. Boom. I mean, it's not.
I know.
In fact, I did a blog on this on Turek on Men's Health. I did a blog on a study. I think it was 2 studies in France and America on what is the at-home live birth rate, or is it what percent of couples who go through the IVF process or a lot of assisted reproduction run out of money or stop and never conceive through the technology? What percent of those couples have a child or a birth or a bio kid after that? And a lot of it's maternal age, right? Maternal age. A lot of it's financial. But it was, everyone, would say anecdotally rare. that a couple has been through 3 or 4 years of stuff failing IVF is going to conceive at home. It was 25%. And it was
That's
in 2
significant.
countries.
Wow.
2 countries, not just America. I got my head taken off by reproductive endocrinologists for that blog. It's like, that's not true. But it's not anecdotally rare. Maybe it's not 25%, but it's not anecdotally rare.
Right. That's controversial.
And that is
kind
diet
of.
and lifestyle and stress reduction and things that Western medicine doesn't like to admit can make a big difference.
Right. To tell the patients to go on vacation seems insulting, but there's some truth to it if we can get them to downregulate the stress and their nervous system and disconnect, unplug.
So I think the value, so acupuncture, traditional Chinese medicine, as a lecturer at Yosan, I think it has huge value in the holistic approach. And I've said this too, but as a guy who's published on the genetics, epigenetics, metabolomics, transcriptomics, proteomics, and whatever omics you want of sperm in men, I am come to believe that diet and lifestyle are massively important. And that is only reaffirmed by our new knowledge of epigenetics.
Yeah.
Which is
right.
crazy.
So we'll probably see a shift where these people who did in vitro and holistic modalities and became super healthy, maybe their offspring will be more fertile.
Could be. I wouldn't doubt that. I mean, that'll take a while to figure out. But
yeah, well, we can look forward to that maybe. But I think I want to start with what conditions this fertility as a biomarker screens for. Like, is it a cardiovascular threat
Got it.
Or is it metabolic, diabetes?
So I think you're addressing the concept that the fertility potential of a man is not only a reflection of that. It's not a moon orbiting the Earth of health. It is integral to the Earth of health
Itself.
Yeah,
right.
And I gave that lecture at Google at the Metroplex in 2011. The next day they shut down Google Health, but I snuck it in there. And I was just, I was sort of out there saying that. But our data and what we had published showed that if a man is severely infertile, meaning really low sperm counts, and clearly male factor, if you look at their life expectancy, well, not life expectancy, but cancer rates, for instance, we went after because we had primary scientific data suggesting that infertile men who were 0 sperm counts had trouble repairing their DNA in their bodies. So this is a pretty large statement. So you can't repair. So let's talk about that. DNA mismatch repair is important to stay healthy. So think of your body as a car going out in the streets of LA every day and collecting dents. And then it goes back in the garage and it comes back. And at night, all the dents are taken out. So it goes out fresh again. Especially like your skin, right? Your skin sees sunlight, bing, there's a mutation, and then it goes back in and then it repairs it. So that's mismatch repair is repairing those dents so they don't become cancerous, because if you don't repair them, they keep going and then you get cancer. So that's the 2-hit theory of cancer. The first hit comes from the environment or whatever, genetics. The second hit is you can't repair that. So they were having problems like that. So we found that out because there were some mice in a journal club that had knocked out these genes and they were getting colon cancers and all these cancers, and they were infertile too. So when you create an animal model like that, a transgenic model, it's a lot of money. It's millions of dollars, and you can't reproduce them. You publish, right? Because it's like you're done. These were, and the infertility was just like the kind of infertility that we see in men, which is called maturation arrest. They have no sperm and they have a certain pattern in their testicles, not cancerous, but strange. And I saw that biopsy and I said, I have men just like that.
Well, and
then we brought into that whole science of mice, we brought to humans and showed the same thing was happening in humans at the molecular level that we were seeing in the mice. Not exactly the same, but order of magnitude, similar order of magnitude. And that scared me because that said that maybe male infertility is the first thing that happens to a guy, the first sign of something else. And if you think about, I'm going to be a little bold here, but if you think about, maybe dramatic, if you think about what you're put on this earth to do, eat, sleep, and reproduce, if you can't reproduce, that's got to be a pretty big problem. In either Dodd or Darwinian view, that's a big problem. So something must be pretty serious to knock out your fertility. I don't know who's thinking this way, but so I said, this is important. And then I had another fellow, Tom Walsh, who was an epidemiologist, and we went to the cancer level and said, okay, the mice are getting cancers. Are these men getting cancers that have this problem? So we had a NIH grant with Mary Krogan, very big one, $25 million or something. And we looked at 25 IVF centers, 25 years, 16 IVF centers in California. There's a cancer registry that's great in California. And we tracked these guys, their licenses and stuff, all the way up to for like 20, 25 years. And we found that longitudinally, they were getting more cancers, prostate and testis. We chose a lot of them, but prostate we figured would be negative control because that's very common and it's an older man's cancer. But testis cancer is a younger man's cancer and it might be genetic. And so we found actually, strangely, both of those were elevated about twofold. So is it really true? I don't know. It's epidemiology. We need verification, but it looks like it's happening. So they're not considered risk factors, but that's interesting. That was published in major medical journals. And then that started the biomarker movement, I think, which is that there's something about fertility in men that is a reflection of more than that. So now Michael Eisenberg and Sadlonia in Italy and a bunch of really bright young men's health specialists are showing that men with infertility have a larger comorbidity burden. So they're sicker than men who are fertile. Sicker can mean obesity or smoking or things like that. But there's more going on at the time they're infertile. There's more heart disease as they get older. So cardiovascular risk is higher. They don't live as long, but much harder to show because there's a lot of suicides and accidents in young men, stuff like that. But we're not saying their lifespan, but there's a lot more death going on in that group. And there's more stretchy data about cancers in the family, cancers in their children.
Meaning like the lifestyle, maybe the way that family...
Don't know the reason, but noticing there's more cancer in the family setting, which could be genetic. And now there's more recent data. I think Jim Hodeling's doing a lot of this about looking at family trees, and the kids are having more issues that are cancerous. So that's very alarming to me. And I don't know if I can bite it and stand on it and really use it because it is epidemiology and it's a little softer than the kind of science I was doing. So, but it's on the radar.
Yeah. And it's definitely something for us to be thinking about it from a holistic perspective. I teach my patients that of the major systems that we have, right? The cardiovascular system, the pulmonary system, digestive system, reproductive system is kind of at the end. It's not needed to keep us alive. So it's sort of like the one that could fall away first in response to inflammation and stress and things. So it's kind of discardable, sort of, but not really. So you're saying the opposite.
Accessory. Yeah, I'm saying it's the most important thing.
Yeah.
Yeah. And so the question is, how do you evaluate men? Where does the semen analysis fit in, right? I told you about the poker comparison, but I would say that when I see a man with a low sperm count, you have to take this one opinion, which is if he's perfectly healthy, it should be high. It should be better. Because sperm production runs hard and fast. It doesn't sit around and want to be improved. It's like full on 5th gear, high RPM, 1,000 sperm per heartbeat. That's what it'll do. Wow. And if you leave it alone, that's what it does. Like a lawnmower, it just keeps running. Needs gas, but it keeps running. So if it's low, with this in mind that we just talked about, I would say my opinion is, what's going on with him? Why is it being held down? And that's a nice way to look at it because I look at everyone individually and I spend a lot of time figuring out why sperm count's not normal. So
why?
So number one is a varicocele.
So a little blockage in the vessel?
No, it's veins that heat up the testis. That's athletic kids get veins in their scrotum. They can't feel them. They're like varicose veins in your leg, but they're not the same. and they're in the scrotum. It drains to the kidney, but it's uphill because we stood up as a species, and it wants to go back down, heats up the testicle like a hot bath, and causes over time, it causes a problem with sperm production. Testicle doesn't grow as well, and it's fixable. So it's an hour of surgery, minor outpatient surgery. So that's 40%.
And easy enough to find, but
physical exam.
But isn't it interesting? My understanding, the standard workup, as the REs are exploring these patients, they'll do a semen analysis, but they're not checking the scrotum.
Yeah, so IVF doesn't do it all, and they're not trained to. And it's a little bit of a problem with American medicine because in Europe, the IVF doctors are also andrologists. So the men get examined there.
Maybe that will happen over here.
And when I was at UCSF, when I was training fellows, I can think of about 6 of them, we taught them how to do it. And some of them were in rural areas, and they were doing it. And I was proud of them because no one else was doing it.
Mm-hmm. I haven't heard of anybody here screening for it. They send them to you.
Yeah. So, but there's an expertise issue too for that. But you have to know if you think it's real or not, right?
But 40%.
Yeah. So that would be number one. Number two, depending on the count, would be genetics. So then you have a guy who has no exposures, right? So his perfect lifestyle is perfectly healthy, and he has no exposures, and you find it might be genetic. And we don't know the whole field of genetics yet, but the Y chromosome can have a dent in it, or the chromosomes can be messed up. They're normal, healthy men. And that's, running around, 5 to 10%. I would say lifestyle is maybe number 2 before genetics and after varicocele, which is, what are you doing? Okay, what are you eating? How much do you weigh?
Where do you work? What are you exposed to?
Yeah, and stressors and obesity and diet, because obesity is linearly correlated with sperm count. That's pretty clear.
You said the waist circumference is where it's at with the declining.
I'm collecting the data.
Yeah. Okay.
I think there's a vital sign we're missing. Mm-hmm. There's 4 of them that we use all the time. And so I'm collecting waist circumferences in everybody because that's the fat you don't want.
Right. It makes so much sense. But what I love about you is you're spotting the trends. And then you kind of
acting on it.
Yeah, writing a blog about it or giving a presentation.
Well, I've been collecting this for now 5 years, so I just have to find someone to crunch the data. And I've been collecting on every patient. So my fertile men and my infertile men. So I'm going to have nice groups to compare.
Great. So
we need another vital sign.
Okay. So what about like blood pressure?
I mean, it's hard to know.
That's easy to collect that.
Well, I guess we collect all 4. We collect the 4.
What are the 4 again?
Well, blood pressure, pulse.
Okay.
Right. Weight. Respirations is 1, and then height. We do BMI.
BMI. Well, I'm thinking a little bit more specific, like so many men have unmanaged blood pressure issues.
Oh, sure.
And then they work in jobs that have exposure to either pesticides or solvents.
Yeah. Mm-hmm. Yeah, so lifestyle, I would put that as number 2 after varicocele, which is pot and smoking, hot baths. I published that study. Terrible for fertility. Terrible. Showers are okay.
Fertility in particular.
Yeah, because it's outside the body. It's like a varicocele. It's heating things up. So you can probably, when I entered the field 30 years ago, it would be maybe half the time you could figure out what's going on with that sperm count. But when you take this point of view and you look at lifestyle, diet, and everything else, you can probably 85% of the time figure out what's going on with that guy. So I think last week saw, 20, 30 patients knew, I would say once, I probably couldn't explain what happened. That's satisfying, because then you could say, this is your problem.
Do this and it will get better.
And so here's your solution, right?
Thank you for helping them. It's interesting.
But then like that too, because it's like, if it's genetic, then the guilt trip goes away. They had nothing to do with it, right? And then they move on. And that's part of the process. Move on when you have to.
But tell them how to fix it. And not only are they fixing it and making their wife happy, but they're probably adding years onto their lives.
I love that. So a man comes in, this risk factor smoking, he stops it. So smoking will check, your sperm shape, your motility, your count. It'll affect your fragmentation rates, functional issues with sperm. Do it long enough, epigenetics. And you stop it and they get pregnant and they call up and say, we're pregnant. I say, congratulations. And there's a second congratulations, which is now we're going to add 5 or 10 years to your life,
Yeah.
which is the real, to me, as a men's health guy, that's the win.
That's the win. Yeah.
That is the slam. That's
Sure.
the grand slam.
Well, your co-host on Talk with Turek, your new podcast, Rob,
Clyde, yeah.
he said he was 325 pounds when he met you, and they were struggling with infertility. And so how'd you get him to get on the dieting, whatever?
He just got scared.
Well,
Which is one of the ways to reach men, is you scare them. The other way is numbers.
what kind of numbers?
So any numbers. If a guy has a low sperm count, they get concerned, right? And they want to know answers, and
Then they take action.
Yes.
Because,
so you work with the numbers. You throw numbers at men, they love it.
right.
They love it. It's an innate thing.
Interesting.
So someone comes in smoking. How much do you smoke? Pack a day. How long? 10 years. That's not good for sperm. Oh, really? My friends smoke. They're having kids. What are you talking about? And I'd say, all right, let's back up. Let's just put a little number on it. So I'll get a DNA fragmentation rate, which is the sperm, and it's a measure of toxins. Really, it's been that way for species, earthworms and other species. It's a toxicity measure of sperm. It's not DNA dam. It's not mutations or chromosomes or funny looking kids. It's just in bad shape, right? And eggs have to fix that damage before they go on and fertilize and become embryos. So you'll see effects on fertility, you see effects on IVF outcomes, and you can see miscarriages.
So you want as low of a DFI as you can get.
Correct. So you want the healthiest sperm. So I'll show them a number. Your DFI is 35%. That's actually too high.
Right.
And they go, well, okay, I guess I'll stop. I'll try. I said, good.
Because then they
love that. The numbers work.
Yeah. Well, then they have if I smoke less, then let's see if I can get it down lower. Like they want that little challenge.
I use it all the time. I say, okay, fine. Let's get some numbers behind it. And they're like, well, okay. And sometimes they'll do it without the numbers.
Okay.
But if you threaten them like that, it's great. It's
okay.
great.
What's another hack? It's another way of getting them to, because the things that you're mentioning, the diet and lifestyle stuff, like soaking in a hot tub, smoking pot, cigarettes, and diet, they're doing that for stress relief.
True. A lot of them
there's the perception that their life is so off the charts intense that they've got to detensify somehow. So what's the suggestion for something besides So
stress is a huge part of it. Stress will lower your testosterone levels. It will lower your sperm count. There was a great study. I think the blog I wrote is, can you be too fit to be fertile? Which is sheer physical stress. There was also Army military stress. But studies have shown that if you're stressed by something, financial, physical, emotional, travel, whatever it is, our bodies have very primitive nervous systems, like a cat, and we respond with fight or flight. Even the email that you got or the text, that jump is their sympathetic nervous system. Your nervous system has no idea what's doing it. It's just feeling it. And that's all cortisol, and there's no testosterone there, because when you're a caveman running from a woolly mammoth, you don't want testosterone, you want cortisol to get out of there.
Go. Yeah.
So we're very good as a species at periods of acute stress. So intermittent fasting, you start intermittent starvation. We're really good at that. I mean, it's actually healthy for us, right?
Because we're designed for scarcity.
Right. But chronic low level stress, like job stress or, internet or being connected all the time, we're not built for that. That's constant cortisol. And it's exhausting. And you see men are just really exhausted. Almost
the adrenal fatigue.
I say that, adrenal fatigue. That's kind of where it comes from. It's that it's the constant stimulation of a primitive nervous system that men don't know is that primitive, right? They think they can control it or whatever.
And so that lowers their testosterone?
Absolutely. Almost by 50%.
And then that lowers sperm production.
So that's a classic cause. And I always tell them, women basically get on the phone with their girlfriends and a mother for 2 hours, they're fine. Men, you got to do something different. And the way I say acupuncture, massage, yoga, or exercise.
It's kind of passive things.
Physically tired. Get tired. So then I say, you go work out, right?
Get tired.
How do you feel when you're done? And they say, it feels really good. It's like, that's the right nervous system. That's right. That's the exhaustion of the sympathetic. So you've outrun the woolly mammoth. You're behind a rock. You find some berries and you'll fall asleep. that's when your testosterone goes up. It's rebuilding you.
Yeah,
it's a rest and restore molecule. So
hence the couples, like the happily married men, more fertile, living longer, healthier lives.
maybe.
Potentially, because their wives relax them.
So that's my solution to acute stress, which is it's killing you. And so I've had guys quit their jobs, go on, start yoga and stuff like that. And it's worked out really well. It's very physical and it works really well. I remember when COVID hit in my men's health practice, it kind of blew up with men who were super stressed. Like, what do I do now? What does anyone do now? My favorite patient was a 80-year-old hedge fund guy. And he came in looking really calm, middle of COVID for another reason or some reason. And I said, you've been around. You've been through a couple of world wars, a couple of recessions. What's up? How should we respond to this? And he goes, well, I don't know. Because if you don't know, he's hedging on this and that all the time. So it was really cool. So no one really knew what to do. So men had two responses. One response with these young guys was, let's go have drinks at 5. Right? Bars weren't open. We'd have our 5 p.m. Cocktail hour. The second one was, I'm getting a Peloton and when I'm going running or inside the house, because it was, you couldn't go outside in the beginning. So Pelotons took off, right? And then I watched these groups of men. The Peloton group, they did great because the stress reduction was really high and they were fit. It was a great response. And the drinkers didn't do that well. So about 6 months into it, they realized they weren't doing that well and they started exercising. And I saw it turn and I was like, great turn, great. Just like a big boat turning, into that. So it was really exciting to see that. But that's the response, right? That's the innate response of humans to stuff.
Is riding a bike really a good idea?
Yeah.
Really? It's not damaging the testicles?
No.
Oh, okay. Okay. If you say so, you're the expert.
Read the blog. It's called Cycling into Childlessness. Cycling into Turek blog.
Okay.
So if you look at the data.
Cycling into childlessness would tell me riding the bike.
That's the title. Yeah.
Okay. So it's to get me to read to see.
Yeah.
Okay.
So the data that says cycling is bad for fertility comes from a study of semen quality in Spanish competitive cyclists.
Okay.
Spanish competitive cyclists are pretty fit, like Olympic class fit.
And their sperm counts are fine.
Terrible.
Oh, okay.
And maybe that's why, because they're biking, right? No, because they're on drugs and they're
enhancement, performance enhancement.
Yeah, this is Tour de France class people. These guys they're bone thin. They're working out 3-4 hours a day.
Cortisol potentially.
Right, it's the athlete. It's the athlete. So they didn't have normal semen quality, and the assumption was they weren't going to be fertile. Right, that was the statement that led to that. And I proposed in this blog to compare to another study, which is commuting British cyclists. So these are everyday people in Britain who commute to work on a bicycle. And look at their fertility. And their fertility was like 50% higher than the average Brit that wasn't doing that.
Wow. Okay.
Right. So they're both measuring different things, but they're different populations. But if you want to generalize it up.
They're both on a bicycle.
Right. Now, if you said, are you worried about bicycling? I say, yeah, erections can be a problem because if your seat is causing pelvic numbness, you're going to have an erection problem because Irwin Goldstein showed that's either arterial or nerve damage from the sit bones. So if you're getting pelvic numbness, you need to get a custom fit seat to your sit bones, which involves going online, getting a pressure thing mailed to you, one of those pressure gel things, and you sit on it and you send it back and they measure the distance and they can, there's only a couple sizes and you can get a seat that won't cause numbness.
Perfect. Okay.
So well,
that answers the question for those people listening. What other things, almost every doctor I've talked to, we talked a little bit about effects of marijuana on the sperm. But you being the expert, what is really going on if they're smoking pot that's so damaging to the sperm? Not just the count, but morphology potentially. What's happening there? And
I have large concerns about marijuana, much larger than just fertility. I have 2 blogs on that. They're 10 years apart and they're damning. But one concerns fertility. So it's worse than nicotine. So it can damage DNA, it can change sperm shape, it can lower the motility, and it can, if in high enough doses, it's like a count. So it can make you infertile both by numbers and by function. And there's some preliminary data from 10 years ago that the epigenetics of sperm can be altered too, which is not great for fertility. It's a functional test like DNA fragmentation. And the other bad thing about pot is, unlike nicotine, it comes in and goes out, pot sticks around. So you smoke it, or you toke it or chew it, and you get a high, and then it goes away, but it's in your fat for a month. And it recirculates at lower levels that you can't feel for a long time. So it's always kind of there, which isn't great, like mercury, but not quite. So that's a problem, because then your exposure is a lot longer, right, for that. And so that's the fertility issue. I'm upset that it's so socially acceptable, and it's probably worse than driving on pot, because your reflexes are so slow and you can't perceive as quickly. So I just worry about that with it, because it's kind of, I think they're starting to check it now, right? You can be tested for it on the road, but I worry about just accidents. And then the most concerning for me is it's very popular among young people, and that's the age of testis cancer. And there's 2 epidemiologic studies that show that chronic pot users have higher testis cancer rates than non-users. And I saw the first one and wrote about it because I didn't kind of know what to think. And then the second one was a validating study that confirmed that data from a separate population. So it's not considered a risk factor for testis cancer, but that is the most common cancer in young men.
What do you think it's doing to the cellular machinery?
No idea.
It's interesting and scary. How do you think pot compares to alcohol consumption with respect to men's fertility and sperm production?
So alcohol is a very small water-soluble molecule that goes to your head, and then it goes to your testicles and gets right in there. So whatever's happening in your head's happening in your testicles. But it's hard to quantify. That's a hard one to quantify exactly. Alcohol can probably affect the sperm directly, but not as much as nicotine or pot. And it also is a hormone problem, because if you drink a lot of alcohol, your liver gets revved up to handle it. And there also gets revved up and takes testosterone and turns it into female hormone called estradiol. So your testosterone levels can fall. Your female hormone levels go higher. So alcoholics, for example, have this nipple tenderness and breast tenderness because they're metabolizing through their liver so fast because it's all revved up. So it's not good for metabolic health. And it affects production hormonally too. So it's probably a direct effect on sperm and a hormonal effect. So I don't know if that's worse or better than, say, nicotine or THC. Not sure.
Yeah, it's those methods to try to escape the root cause, which is unmanaged stress.
So exercise, yoga, massage, or acupuncture. Acupuncture is great at getting your body down, right? Who doesn't feel relaxed after a massage? Who doesn't? You're not sympathetically activated after that. Right,
exactly. So some good suggestions. We're going to be running out of time here, and but you've got your podcast that just launched in 2024. You're going to be covering a lot of these different
We're going
issues.
to go deep on everything.
Everything, I believe
everything men.
Right. It's going to be...
I have to say, the blog is 700 posts. I wrote every one of them for 15 years. There's no book on it. This is basically the book of that. And it's, so it's Turek on men's health. And, we're going to go everywhere. The penis, testosterone, sperm, the spermageddon, all that stuff,
Right. Yeah. What's your closing piece of information for the guys listening or their wives listening with respect to baby making? As I will just tell you that the majority of people coming in, for the women listeners, they want them to know, if you can open your mind and be expansive, then believe that the right baby for you is coming. That's kind of like been a cohesive, there's different ways of doing it. But you speaking to the men, it's a different messaging. I'd want them to be empowered somehow, and I'd want them to feel seen and as a bigger part of the equation. And I feel like you are the authority voice on this, as I'm going to have some other male guests, and they can talk on men's purpose and psychology of men and emotionality, but from the standpoint where you have all this science, all these decades of experience and surgeries, the microsurgeries, I really wanted to talk about your sperm mapping. That story I love so much with the couple, and 10 years later, the sperm was exactly where you had mapped it to be for them. But like men, how can we help them to feel like a bigger part of the equation?
Well, I've always, what I learned in my practice, it's really hard to get groups together of men. So I have been unsuccessful on so many levels trying to get men to assemble. Podcasts are the way to get to them.
They're listening.
Yeah, they weren't listening before, but you get guys with their lawnmowers or out for,
Sitting
doing
in the car.
something beautiful. And finally, right? So you got to get them where they are. So that's the secret. Don't try to get them to come to a doctor all the time because they're not built that way. So here's an example. I was in Washington at there was a movement for the Office of Men's Health, maybe a dozen years ago. It was Obama era, and they asked a bunch of us to come to the White House for a dialogue on men's health. So there's a YMCA, and there's a couple of sports teams. The Packers were there, and men's health groups, Black caucuses, and me. And I wasn't a professor at that, but I was just a guy in a suit sitting there, but had some influence. And all day we were talking about how do we reach men? How do you reach them? So champions can work. Like, you have someone like Rob Dole doing erection stuff, lightens up the field, or an athlete. So the athletes are great. Champions are followed by so many, admired. But it's still hard. And at the end of the day, we really didn't have an answer, because that's the secret. If you can get at men, you have to go where they are. You can't change them. So I actually raised my hand at the end of this day, and I said, Attorney General called on me, and I said, or Surgeon General, and I said, you can reach men. And everyone's kind of shut up. And I said, I have this app that I use to follow men after surgery. It's a proprietary app where I check in with them every day. And it's app based. So I just say, how are you doing today? How's your pain? How's your swelling? How's your bruising? Here's a text box. Send me a picture. So every man gets 2 weeks of daily care by me and my nurse practitioner after each surgery. And I can do 40 surgeries a month in 2 cities and take my own call and have it work out, right? So it's dialed in.
So it's
95% engagement. I told them 95% engagement. I said, how do you do it? I said, because I'm getting on their time where they are. It's anonymous. It's low key. You're not making them do a lot of work. They just have to answer an app. I think the conclusion from the day was we probably need to reach them on their phones in a non-invasive way. So you got to work with the beast. That's my secret. And the way to work with the beast in this practice is the partners.
Because the partners are
They lead the
unhappy?
way. No, they lead the way in their care.
Right.
So my blog is read by 75% of the population's women.
Right.
And so I don't fight it. I mean, if that's the secret, it's the secret. I'm on the boards of several femtech companies, and I'm saying, you're the opportunity here. You're the one.
Help
and
your
now
guy.
the hard one is the uncoupled man. How do you reach him for his health? That's harder. That's harder.
Do you have a sense?
Not really. I mean, gay population really takes good care of themselves, but they had a huge scare 30 years ago with HIV, and they're fantastic at self-care. Fantastic. As a group, I just clap, like nicely done. But, it's hard to get at the single guys trying to make it in this culture.
Yeah. Well,
especially with Me Too movement and stuff. So the other thing about the podcast and the blog is it celebrates men. It celebrates the differences in men. It sort of says, don't try to change them, just understand them, because maybe they can be changed, but some things they can't, and they are different. And we need to appreciate it and work with it, because that's what my success has come by working with the beast, getting them where they are and working and getting them to change. And for instance, one example is I want them to remember me when they meet me. So the blog is one way, because it's sort of well written. It's very concise and it's poignant. And the other is when they come to the offices in both cities, San Francisco and LA. I mean, it doesn't look like an office. It looks like your living room, but it's kind of got more character. And you can tell they like cars, and you can tell they like to surf. And so they see that this doctor actually has a personality. And then they meet me. And I learned early on, if you don't listen to them, you're getting nowhere. If you just start talking. So the first 10 minutes of every visit is, how can I help you? I may know what they're there for, but I'm just going to ask them, because sometimes it's different from what they tell someone up front. And so I listen, and that's new because no one listens to them.
Yeah.
And then they see that I have personality and that they can attach to it. So it's a closed book initially. And if they feel comfortable, they open the book. And then you learn something. You're going to learn what you really need to know, not what they wrote down or what they told someone else, but you're going to get the real deal. And I've had my hallway conversations with men are the most powerful things you can have, which is you have the visit. It's pretty medical. They're getting up, they walk out, they stand at the door, they look back and you say, by the way, and then I say, sit down. So that's where you catch them. You got to catch them, and you got one shot at it. So those are the philosophical points. You got to listen. They have to be able to know that you're real. And, and I want them I want to take care of them. It's got to be a 5-star experience. It has to go well. And, you got to warn them what you're doing so they don't get super scared. They come in with really high blood pressures. Sometimes it's on the first doctor they've seen. So it can get, and I want them to call me 5 years later and say, I hurt something, or I have blood in my stool, and you're the only guy I trust. And I say, perfect, I'll find you somebody. I want to be the medical home for them. They feel that. That takes a lot of work to do that, but that's what and you have to, if they mess up, you got to forgive them, and you also have to hound them.
I think there's a future book for you, Dr. Turek's Guide to Men. Yeah, please.
That's the title of the book, kind of. It's like the art of man. That's kind of what it is.
Yeah, well,
the blog is seldom.
Right. Through the years with the blog, it leads to this book.
Yeah,
for you. It does. But it's within you. All right. Well, Dr. Turek, please tell us the websites. It's the Turek Clinic.
So the TurekClinic.com. Yeah. Turek on Men's Health is the blog. At Talk with Turek. Talk with Turek is the YouTube, but it's on all the channels.
Podcast.
The podcast is on all the channels. Yeah.
Okay. And you have offices in LA and
San Francisco.
San Fran still.
Weekly. Yeah.
Okay. Well, thank you so much for everything you put into this for men.
Yeah. Good work you're doing.
Yeah. Thank you. You too.